The OPTIC trial is the study on Ponatinib that looked at different starting doses of this drug among patients in chronic phase that had received 2 or more prior tyrosine kinase inhibitors and were resistant or intolerant, or who had the T359 mutation. So patients were randomized to receive as the starting dose either 45 milligrams, 30 milligrams, or 15 milligrams. Notably, once the patients achieved the response, the primary endpoint was 1% transcripts or less, 12 months. Once they achieved that response, they were required to reduce the dose to 15 milligrams daily. The primary analysis of the study has already been presented and published. That was the response at 12 months. Again, that was the primary endpoint. What is being shown now is the responses at 3 years. So now that we have longer follow-up, and importantly, this continues showing the benefit of 45 milligrams daily as the starting dose. There is a significant improvement in the probability of response. It was about 40% at the 12 months. It's increased to about 60% now at the 36 months with the 45 milligram daily dose. And it also shows that those patients with T359 in particular have the greatest differential probability of response in favor of the 45 milligrams daily, although the other cohorts, patients with other mutations or with no mutations, also seem to have a numerically higher response rate with 45 milligrams daily. And also, the more refractory the patient had been in the past, the more likely they're going to benefit with 45 milligrams. We continue seeing low rates of arterial occlusive events, which was one of the drivers of this approach of reducing the dose. But the exposure adjusted rate is about 4.5 per 100 patient years. That is higher than those who received 30 milligrams, which was 3 percent per 100 patient years, but that difference is relatively small. So clearly, this study and this follow-up shows that the best risk-benefit ratio favors the use of 45 milligrams as the starting dose for most patients, which makes it gives us the most efficacy with only minimal increase in the risks for these patients. So this is important as we manage our patients who have this indication for the use of Ponatinib.